better quality of life and overall well-being. That is why delivering quality health care is paramount. South Africa is committed to the achievement of the United Nations Sustainable Development Goals. We are committed to the SDG goal of ensuring healthy lives and promoting the well-being of all at all ages. This is a bold commitment to achieve universal health coverage. It is a commitment to provide access to affordable medicines and vaccines for all. If our nation's health is truly to be our nation's wealth, we must fix our healthcare system. A better healthcare system improves health outcomes, increases life expectancy, and lowers the burden of disease. This enables us to better protect the population against public health emergencies, whether it be HIV and AIDS, COVID-19, as the Minister just indicated, Mpox, and others that are yet to come. A well-functioning health system improves access to care and quality of care. It enables us to make more efficient use of valuable resources, from human resources to medical supplies to technological and financial resources. This results in lower healthcare costs for individuals, for families, and also communities and government. However, our public healthcare system has many challenges. These challenges prevent government from providing decent quality health care to all South Africans. It is for this reason that in 2018, as the Minister indicated, we convened the first Presidential Health Summit. This brought together many stakeholders engaged with the health system, including policymakers, academics, planners, service providers, educators, health advocates, and users. This resulted in the signing of the first Presidential Health Compact. Together we made a commitment to support the Department of Health to implement the 9 pillars of that compact. These pillars include improving human resources, capabilities, and expanding access to medicines. They include ramping up health infrastructure, development, and steadily improving the quality of health services. We made a commitment to better financial and information system management, good governance, and community engagement. We affirmed the important role played by the private sector in strengthening health systems across the board. Today, Program Director, we will be signing the second Presidential Health Compact. This is an opportunity to reflect on progress since the signing of the first compact. The introduction of the Human Resource Training Grant during the COVID-19 pandemic enabled the department to create more than 73,000 new posts. The private sector also continues to support the workforce development, health workforce development. For example, the Public Health Enhancement Fund has trained 100 doctors and 75 masters and doctoral graduates. Access to medicines, medical devices and equipment have been expanded. New technology is being used to improve supply chain mechanisms, streamline regulatory processes, and reduce backlogs. The development of local manufacturing capabilities is being prioritized to expand access to medicines. We have been consistent that building a stronger local manufacturing industry is key to our country's health security, especially during pandemics. Technology is being harnessed to improve patient record systems. During the pandemic, we were able to speed up this process. By last year, 50 million people had been registered on the health patient registration system. We are expanding our health infrastructure. By November of last year, 149 new primary health care facilities had been completed. 30 new hospitals are either opened or are under construction. We are implementing the National Quality Improvement Plan to ensure that more public and private facilities meet the Office of Health Standards compliance requirements. This is in line with the requirement of the NHI. The National Quality Improvement Plan has led to an increase in positive patient experiences at public health facilities. Positive experiences reported by patients rose from 76% in 2017 to 85% by March of this year. Healthcare funding faces challenges due to budget cuts and a constrained fiscal environment, compounded by, amongst others, inefficiencies, mismanagement, and corruption in education. Budgeting in the health sector is steadily improving to ensure a more equitable allocation of resources. Less money is being lost to litigation. This is thanks to the hard work of the Health Sector Anti-Corruption Forum, which continues to expedite prosecutions and recover stolen funds. The private sector has a crucial role to play in strengthening health systems. Our experience with COVID-19 showed how we could deepen public-private partnerships. With greater collaboration, the resources and capabilities of both the public and the private sectors can be brought to bear to serve those who need health care the most. With the NHI Act now signed into law, it is even more urgent that we work together. As we implement the NHI, we will build on lessons learned to streamline standards and ensure quality of care, whether it is rendered at a public or private facility. We need diverse expertise as we work towards strengthening health systems and building their resilience for the future. We need to share resources to ensure that programs are implemented. Involving the private sector, labor, and civil society throughout this effort is key to ending inequality in healthcare. It is up to us to build on the successes of the first presidential compact. We need to ensure that the second presidential health compact that we are signing today is responsive to the challenges facing our health care system. To all our partners, we say, please keep up the good work, continue to demonstrate the progress that we are making, and deepen collaboration so that we overcome these challenges. Our nation's health is too critical, too essential to development to be weakened by mismanagement, funding crisis, or other problems. We expect all stakeholders to bring solutions and work with the Department of Health and Science and Innovation to implement them. Implementation is the foremost priority of this 7th administration. Program Director, I have full confidence that implementation is a priority of all of us as we are gathered here this afternoon. I therefore wish all of you well and hope that working together we will indeed succeed. Thank you very much.
Thank you very much, Your Excellency. I think after the acting president has so warmly welcomed you to his house, you can do better with that round of applause. Thank you very much. We will now commence with and thank you very much. Minister Mashatile. Please don't impede the cameras. Thank you. Thank you very much. I'd like to invite the MECs present, the Deputy and the Director Department of Health to just join the acting president and ministers for a picture before we invite other social partners for the signing. The MECs present, the Deputy Ministers, the Director General from the Department of Health and other DGs present, please come forward and join the acting president and the ministers for a picture. Thank you. Please hold the books forward for the makes his way to the front. Association. So that we can proceed. Get Mr. Mabala in the front. Once the signing has been concluded, we'll just take a picture and release the signatures. Thank you. We will now have and the NHI campaign. As they signing are to be followed by Ms. Boitumelo. Ms. Dr. Citric and Ms. Boitumelo Molete. Smile for the picture. As they invite Mr. Kaya Sotiti Afretinosa to be forward from campaigning for cancer. Thank you. Okay, we smile for the picture. To Ms. Lauren Pretorius, SODD, I'd like to the South African Medical Research, and he will be joined by Masha from the South African Pharma. Ms. Pretorius. Mr. Pasha has signed. Thank you very much. I'd like to invite Nduku for African traditional health. I won't read them. The signatories. Invite all the signatories to the picture with the ministers, or the MECs, and as well as the DGs. Family photo. Thank you. Books. Please bring the books that they signed with. I'll ask our colleagues in the group picture. They're stepping to the front. Let's please for applause. Thank you very much. Thank you very much. Ministers remain seated, and while the MECs. I'd like to now invite the technical advisors in the presidency of this endeavor to come and join. Thank you very much. Of the I'd like to, on behalf of President, to thanks for this afternoon, and many thanks to the ministers for making this day possible. Many thanks to Dr. Pasha, the MECs, who've made this day possible, and our colleagues in the media who've also, without them, the public will not be informed. I'm advised to make himself available, acquire further engagement, and have Minister of Health will make for engagements. I'd like to invite the acting president to us, and thank you so much of the proceedings. Thank you. Please give yourself a round of applause. Again, the acting president.